So we stopped with some exercise. Right, yes. Let us find it. Here it is. And so we were speaking about the passive voice and how passive voice is formed. And so here we need to change the sentences into passive voice, and we should decide whether these sentences require an agent or not. Well, let us listen to Lahari. Read the first sentence, please, Lahari. Lahari? Hello?
Yes, ma'am.
Okay, read it, please.
The doctor inserts the needle.
And if we change it into the passive voice?
The needle was inserted by the doctor.
Mm-hmm. So you decide to use the past simple tense, the past simple passive. And if we use the present simple passive, because it says the doctor inserts.
The needle is inserted.
Yes, is inserted. Do we need to mention the doctor, or just we can?
No, ma'am.
No. Mm-hmm. Okay. So please, Manish, second sentence.
Yes, ma'am. Nurses often perform this procedure. This procedure is often performed by nurses.
Do we need the agent?
No, ma'am.
This procedure is often performed.
Performed.
I think here we need nurses, by nurses, because without nurses, we don't understand what the sentence is about.
Yeah, ma'am. Yeah, ma'am.
The agent is obligatory here. Just a minute. Okay. Well, now, Pradeep, sentence number 3 is for you.
The doctor then applies gentle pressure to the puncture site. The puncture site is pressure applied by the doctor.
Let us start with the gentle pressure.
Okay.
Gentle pressure at the beginning of the sentence.
The gentle pressure to the puncture site is applied by the doctor.
Is applied by the doctor.
Then applied by the doctor.
Is applied by the. Okay. Yeah. Do we need to an agent here? No, we don't need. Gentle pressure is applied to the puncture site. It can be okay without mentioning the doctor. Okay, so the next is for Rohita.
Okay.
Next sentence, please.
The sister explains the procedure to the patient. The procedure to the patient explained by the sister.
So the procedure is explained to the patient by the sister. Mm-hmm. Or we can just use this sentence without the agent. It can be the procedure is explained to the patient. Full stop. Well, the next is for Bhuvanesh. Number 5.
Yes, ma'am. The skin is cleaned by the nurse, ma'am.
It's cleaned by the nurse. It's cleaned. Do we need, does the sentence require the agent here?
Yes, ma'am. No.
Or can we say just the skin is cleaned? Is it okay? Yes.
Yes.
So we do not necessarily need the agent here. Well, now please, Sohita.
Yes, ma'am. Doctors without training don't perform this emergency procedure. This emergency procedure is not performed by doctors without training.
Mhm. Does the sentence require the agent?
Yes, ma'am.
Yes, because we're just this is without this, it doesn't make sense. Mhm. Okay. Well, now Afnan,
Yes, ma'am.
number 7.
The taps the vein. The vein is tapped by the doctor. The
Exactly.
vein.
Or it can be just the vein is tapped. Mhm.
Yes, ma'am.
That-
The
that-
agent is not required.
Yes. Mhm. And the last one is for Khadija is not here. Mayuka, please.
Generally, nurses don't perform this procedure. This procedure is not performed by the nurse.
Is not performed by the nurse. Yes, the agent is necessary here, so it requires using an agent. Okay, so these are the examples of how we can change sentences into passive voice, and one of the home assignments will be to complete some exercises with the passive voice, verbs in the passive voice and in the active voice. So just to check how well you remember this information. And now let us focus on the gastroscopy. Here we have the diagram. There is a diagram showing the consistent parts of this medical instrument. And the task here is to use the words which are given to the right to label the diagram. So in number 1, what is number 1? Which phrase matches with number 1?
A light and camera.
No.
Endoscope.
Endoscopy.
Endoscope. Yes, endoscope. What about number 2?
Side channels for introducing other.
Yes, channels for introducing other instruments. Different instruments can be just used, applied here. Well, number 3.
Flexible tube.
Flexible tube. Number 4.
Grabbing instrument.
Grabbing instrument.
Yes, this is for biopsy. And number 5.
Light
A
and
light
camera.
and a camera.
Button camera.
Yes, at the end of the
Light and camera.
of this
Light and
code tube. Okay, now we just understand how it works, and let us look at the following sentences. You see that there are the gaps in the sentences, several gaps, and we need to think of what should be used in each of the sentences. You see that these sentences are taken from a training session for doctors. And we should complete them by choosing one word from noun list and one word from verbs list. So the nouns here are section, consent. Who remembers what consent means? Consent.
Patient's consent for the
To the procedure, agreement. And patient, air, endoscope, mucosa. What is mucosa?
Membrane.
internal layer of the
Of the body.
Stomach.
Okay.
Yes, sir.
And the verbs are blow, advance, swallow, give, obtain, sedate, anesthetize, and biopsy. Biopsy here is not a noun, it's a verb here, to do something, to biopsy. Well, and you see that all the verbs in these sentences should be used in the present simple passive, like is done, for example. Okay, and so we need to think of the right noun and right verb for each gap in sentences. Now I would like you to do it individually. Just you make notes on the paper, and I'll give you 5 minutes to complete the sentences. And then after we've done, in 5 minutes, we'll check what we've done. Okay? Start, please. Start writing the sentences. So 2 minutes left. Well, let's just check now. And now let us listen to Rina. What do you think is missing in the first sentence?
Informed patient. Informed.
And what is done with the patient, with the informed patient?
Patient to give.
So this is the sentence about something that we get from the patient. So, and if we get something from the patient, which verb should be used?
Obtain.
So in which form? Is obtained.
Is obtained.
Okay. And what is missing in the first gap? What is obtained from the patient? Before we start a procedure, what should be obtained?
Consent.
Consent. Yes, exactly. Informed consent is obtained. Okay. Now, Hargavi, please.
The pharynx is dashed using a spray. Is blowed using a spray?
Spray. What kind of spray is it about? The spray to help what? Why is it applied?
To clear.
Some specific spray that makes the pharynx, the throat, numb. Yes?
Anesthesia.
Yes. So the pharynx is anesthetized using a spray. Okay, Vidya, please.
Yes, ma'am. The patient is patient.
Drowsiness is when a person is sleepy, just yawning.
Yes, ma'am.
So, and what can cause drowsiness? What kind of substance?
Anesthetize.
Anesthetic substances or
Sedate.
sedative.
Sedate.
The patient
The
is
patient is sedative to induce drowsiness.
yes, sedated. Okay, the fourth is for Lahari.
Yes, ma'am. The dash is introduced and is further down the esophagus and into the stomach and duodenum. The
Well, what kind of instrument is introduced?
Endoscope.
Endoscope.
Endoscope is introduced, and what is done with the endoscope? With the tube?
The advanced and is advanced for no.
Yes, you are right. And is advanced further.
Advanced further down the esophagus.
Okay, great. Well, the next is for Manish. Manish, please. The next one.
Air is blown into the stomach via a side channel, the endoscope to allow visualization of the stomach. Air is blown.
Air is blown, right. So the next is for Pradeep.
The patient is given a plastic mouth guard to bite on. Plastic given one. Plastic
is given. Exactly.
Patient
Good.
is given.
Well, Rohita, please. Number 7. Rohita? Hello? Are you here? Rohita?
Yes, ma'am.
Number 7, read it, please.
The patient is asked to swallow the first section of the endoscope.
To swallow the first section. Exactly. The next is for Bhuvanesh. Bhuvanesh?
The stomach is dash is using a thin grabbing instrument which is passed down the side channel. The stomach section is
Section was used in the previous
given-
sentence. The stomach, or what is inside the stomach?
air, ma'am.
The specific layer.
Mucosa.
Mucosa.
Yes, ma'am. The stomach mucosa is
So this is
biopsy
about
using a thin grabbing,
uh-huh,
ma'am. Biopsy.
biopsy using the thin grabbing instrument.
Grabbing.
Okay. Yes, you're right. Thank you. And now we have the same sentences with the answers, which are highlighted here. And so here are informed consent. Pharynx is anesthetized. Patient is sedated. Endoscopy is introduced. Air is blown. The patient is given. He's asked to swallow the first section of the endoscope because he is biopsied. And let us think, are the steps presented in the correct chronological order, or should we change something in the order of the sentences? We should change, and we should put them in the correct order. So I think, okay, if we have a look at the first, informed consent is obtained. Is this okay? Yes, this is the first. Which sentence goes next?
Sedation. The patient is sedated to
Sedation.
induce.
Okay, the patient is sedated to introduce drowsiness. And what is the next?
The pharynx is
Anesthetized using a spray.
using a
Okay.
spray.
What is number 4?
The patient is given a
Plastic mouth guard to
Python. Number 5.
Patient is asked.
The patient is asked to swallow the first
First
section.
section of endoscopy.
Yes, you're right. The hardest step to swallow the section of the endoscope. Okay. Number 6 now. Number 6.
Endoscope is
The
introduced
endoscope is
and is advanced
introduced
further
and is
down.
advanced.
Okay. That was number 6. Number 7.
Air
Air is blown into the mouth or stomach via
via
side
side
channel.
canal.
Okay. Number 7 and number 8.
Stomach
The stomach
mucosa is
Stomach mucosa is
dioxide using a thin grabbing instrument.
Yes. So now we know the correct order of actions, of steps. And now we are going to listen to our Dr. Quinn. And he's explaining the endoscopy to a patient, Mr. Beacon. And the task is to listen and answer the question, which steps from 1 to 8 does the doctor mention? So, I mean, you need to make notes just to fix the steps. Well, now let us start. And you tell if you can hear.
Listening to. I need to explain.
Can you hear?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Well, did you manage to write the steps? Or do we need to listen for the second time? Do we need to listen more? Second time, okay.
Second time.
Yes, ma'am.
I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
So if we go back to the previous slide. So which steps was mentioned by Dr. Pin?
Consent is
Second one, third one.
Second one, third one.
What about the first one? Did
Yes, ma'am.
one is also in
Yes,
yes,
mentioned.
it's about
First, second,
consent forms, signing the consent forms, okay? Then you say the parents.
Fourth one also.
fourth,
Yes.
Fourth one also.
Fifth one.
Fifth one, air is
Eight.
blown. So
Air
we
is
can
Fifth one also.
One, ma'am.
Okay. About
Except
tube, bendy tube, yes.
Except six.
Biopsy also was mentioned.
Yes, except six.
Yes, ma'am.
6 and 7 he didn't mention.
Okay, good. Anyway, we understand what they are speaking about, and I would like you to focus on the language which is used by the doctor.
Listening to.
I mean, the words. He doesn't use just technical medical terms in his explanation. So here on this slide, we can see the words of the medical terms. And now we are going to listen for one more time and just to focus on the words that I use instead of these medical terms. So do you know all the words here, the meaning of all the words here? Esophagus, anesthesize. Esophagus, what does it mean?
Stomach.
Okay.
gullet,
Pairing.
Palate.
throat.
Palate, ma'am.
throat,
So flexible
And tube.
biopsy, sedate,
Bendy.
examine,
To
irritate.
see.
What does it mean, irritate? So it means to go up
Land.
from a lower position to a higher position, right? And visualize, I think is clear, okay? Now, please make notes about the words, the language which is used by the doctor. Now.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Well, instead of esophagus, what does the doctor say?
Gullet.
Through throat.
Gullet, yes. Instead of anesthetize.
Something to relax.
Numb. So it says numb with a spray. Pharynx.
Throat.
Throat, yes. Flexible.
And tube.
Bendy tube, yes.
Bendy tube.
Biopsy.
Take a
Tiny
tiny tissue sample.
Tiny tissue.
Yes, he says take a tiny tissue sample, yes. Sedative.
Something to help
Relax.
you.
Something
Yes, that helps to relax. Examine.
Look at your
Look at.
stomach.
Irritate.
Belch.
Full and
Belch,
or
yes.
bulge.
Belch. And visualize.
To see.
Examiner.
see clearly.
See, we'll see. Yes, he says we'll see. So this is a good example how to simplify the language, how to make it easier to understand, to help the patient to understand the complicated procedure.
Listening.
Well, yes, actually, they are given here on this slide. And now we are going to speak about your home assignments. So the first assignment is to complete the passive voice exercise on the Moodle site. The file is attached there. This is the grammar task, the heading for this task. You just look at the sentences and you write only the answers. Don't write the whole sentence, just only the answers in a column. And the second task is writing an essay. And I would like you to type this essay just on computer in Word format, so that the file should be clickable and accessible for editing. And the essay is called What I Know About Al-Farabi University. And this essay will help us in just in better understanding students and just in to get some feedback from the students about our university. And in this essay, you should write, you should cover the following points. They are given here. So in short, your name, age, education, city, the part of the country you are from. So what you know about Al-Farabi University. I mean, of course, you can do the research about the university. Or maybe you just write what you know about the university now, just without any research. And because I think you have done the research before you enter the university. And the next point is why you want to study at Kaznu. The reasons why you have chosen this university. And then the impression you got of the university and the teachers. It's very important for us to know what you think of the university and the teachers. Okay. So the tasks are given on Moodle site, and you remember that the deadline for submitting the tasks, the assignment is Saturday night. Well, and just you should type the essay. One of the documents should be in, like the screenshot, the PDF, and the essay should be in Word. So typed in Word, okay? I see. Any questions?
What's the word limit for this essay?
The word limit. There is no word limit. It shouldn't be too long, what you would like to write. So no limit. Mhm.
Okay.
No questions. Okay, so now you start working with the passive voice on the Moodle site. Yes, the passive voice exercise, which is on the site. Okay.